The pioneering NGOs in Bali have been at the forefront of the response to the HIV epidemic in Indonesia since the early 1990s. Engaged in both advocacy and the community response, they work with men who have sex with men and transgenders, sex workers and their clients, and support groups of people living with HIV. The field workers, including the ones in this film, develop strong, trusting relationships with the people they reach and provide support, education, referrals for clinical services, condoms, and for injecting drug users, needles and syringes. They have been responsible for bringing about significant behavior change as well as social change in the communities where they work. Dua Hati works with injecting drug users in communities ranging from those in prime tourist destinations like Kuta and Ubud and urban Denpasar to remote villages. The IDUs tend to group by their interests. In Kuta and Legian on the coast, quite a few are part of the servant community, where outreach workers meet them. Dua Hati outreach workers are local and may belong to the communities they work with, so they readily access and understand their clients and build trust. For example, in the Ubud area, this outreach worker identifies safe houses for his clients who prefer to avoid government clinics. The camaraderie with which he is greeted and the relaxed atmosphere in which the discussions take place clearly indicate the trust these users have in him. Dua Hati's needle and syringe distribution and clinical referral service have reached far into the various injecting drug use communities, which are otherwise inaccessible, and through collaboration with Dua Hati, the community health centers can now provide clinical services to IDU. The outreach workers have earned health workers' respect and have become an invaluable resource for them. An example of excellent synergy between the outreach programs and government services is a local government community health clinic in Kuta, where healthcare providers in the methadone clinic are at ease with their clients and their clients display open trust in the staff in return. The outreach workers monitor their clients and they have regular support group meetings in the car park of the clinic. The clinic has become a haven where the IDU are at ease and can discuss their problems with drug use. In 2013, Dua Hati's outreach workers reached over 800 IDUs, nearly all the IDUs in Bali. Casual sexual encounters are part of IDU's lifestyle, so Dua Hati outreach workers' promotion and distribution of condoms are very important. It is important to put this all into a historic context. When Dua Hati was established, professionals were apprehensive about large numbers of HIV-positive IDU in Bali without services. It is gratifying to see now that there is less stigma and risky behavior and comprehensive services available for IDU. This bears testimony to the value of sustained outreach programs manned by credible, professional outreach workers. In Bali and other parts of Indonesia, there is a wide gap between high-risk groups, including those who are HIV positive, and the people in health and related sectors, who are responsible for their care as well as for preventing a wider epidemic. Outreach workers in Bali are bridging that gap to help people at risk and to link them to services. Without the outreach workers, it would be nearly impossible to identify and communicate with individuals in these high-risk groups, let alone teach them to modify their risky behavior. Often coming from marginal sections of society themselves, the outreach workers are perhaps the most unsung of all in this ongoing battle against the spread of HIV. They have first-hand knowledge and access, they are prepped and informed, but most of all, they are deeply committed to their work. The work of these organizations and the compassion and dedication of their outreach workers is essential to containing the HIV epidemic in Bali.